Well, hey guys, happy Vlogmas Day 21. Welcome back to the Q&A. As I mentioned, today I'm going to be addressing all of your questions about tretinoin for acne. If you missed my prior two Q&As, go back and check them out. I've got a Q&A from 2 weeks ago that overviews tretinoin in general, and then last week's Q&A I talked about tretinoin for anti-aging and wrinkles. So if those are of interest to you, backtrack and check them out. I will list them down below. And if you're new here, welcome. My name is Andrea. I'm a dermatologist. I film day in the life of a dermatologist vlogs. I've been having a ton of fun sharing Vlogmas with you guys and uploading more festive themed videos daily this month. And I also do a lot of skincare product reviews and skincare ingredient overviews on my channel. So if that type of content is of interest to you, I encourage you to subscribe to my channel for more. So tretinoin, as I mentioned in my first Q&A, is a drug that's been around, since the 70s, and its first indication actually it was for acne, okay? So it's been used. One of the most common questions that I get on here is what components of acne can tretinoin help with? So it can help to unclog pores. It can help to reduce the number of breakouts that you have. It can help to reduce the number of red, inflamed, active pimples that you have. And it also can help to improve some of the discoloration that you may have from healing acne if you are somebody with a darker skin type and dark spots as a result of healing acne. Tretinoin also can help if used consistently and for the long term. It also can help with helping to boost collagen production in the deeper layers of the skin, improving the appearance of scars that are the result of healed acne, okay? So it's not its most robust feature, but it's one of the things that, it's one of the few creams that we have that actually can boost collagen production and improve the appearance of scars. So if you're somebody whose acne has healed with scars, it can help if you use continuously and for the long term, such as for greater than 6 months, for example. It can help boost collagen production and improve the look of those scars. The second question that I get a fair number of times in the comments is, well, how long do I have to be on the tretinoin in order to start seeing improvement in the acne? It can usually take, honestly, after 6 weeks, people really do kind of start noticing some improvements, but the best improvements and the kind of most striking improvements, if you will, really are noted at 3 months of continued and persistent use of tretinoin. So it takes time, but anything in the skin and anything in dermatology generally takes a couple of months before onset. So it really requires you to be very patient and have a little bit of faith in the cream. Now, in my first Q&A, I talked a little bit about the side effects of tretinoin, and if you've been prescribed this cream, you're probably very familiar with the fact that it causes quite a bit of dryness and irritation. And peeling. And honestly, I think that's one of the things that people struggling with acne have the hardest time coping with when they're prescribed tretinoin is the redness, peeling, dryness, and irritation. Do know that that does get better, and a tip to help improve that is to be sure and use a thick, non-comedogenic, although I've said on here before, non-comedogenic, you really can't put much stock in that term, moisturizer to help hydrate the skin while you're using this. I can list some down below in the description box that I think are fantastic and are very low likelihood of breaking you out. In addition to the irritation, probably one of the most frequently asked questions, and I think a big concern on the part of people who have been advised to use tretinoin, is this the tretinoin purge, or the retinoid purge, or worsening of your acne. Yes, oftentimes the acne can get a little bit worse in the first 2 to 3 weeks, sometimes out until around 4 to 6 weeks, depending on how the burden of acne in your skin. But that generally improves after a few months at the most. And so what I would say is, it's not a reason to fear tretinoin, okay? Uncontrolled acne is far more scarier and far more likely to be a long-term problem for you with subsequent scarring than any acute flare from using a retinoid, which subsequently would then give you good control of your acne, okay? So it's definitely something to not fear. And the other thing that I would say is that if you're somebody who has been given tretinoin and say you didn't get a chance to follow up with your dermatologist and you've been using it consistently and you're still going through what you perceive to be a quote purge and it's been several months, then I encourage you please to follow up with the dermatologist, because to me that really suggests that your acne may be the subtype of acne wherein tretinoin alone is not adequate and you need an additional agent to control your acne and prevent scarring, okay? So while tretinoin is extremely effective, it's not effective for all types of acne alone, okay? It generally is effective alone for certain types of acne and is effective along with other treatments and other medications in other types of acne. So very, very important that you follow up with a treating dermatologist and not just assume that it is simply the tretinoin purge or the retinoid purge. It's very important to make sure that you're having an appropriate response to the treatment. So that brings me to the next type of question that I frequently get in terms of, well, I have hormonal acne. Is tretinoin going to be helpful for hormonal acne? I would say hormonal acne is one subtype in which tretinoin on its own is not usually effective. I say usually, occasionally it can be, but usually hormonal acne needs an additional agent, an additional oral medication frequently. Tretinoin cream, while effective for the pores, while effective for the inflammatory lesions, it does not really impact the hormonal component of acne, which unfortunately so tends to be more often a bigger player in the hormonal acne of women and adult women. And tretinoin simply doesn't really robustly target that aspect of the acne pathogenesis in hormonal acne. So hormonal acne along the jaw area, that's one where tretinoin is useful. It's frequently used along with other things, but it is not often good enough on its own. I get many questions about hormonal acne. In 2 weeks, not next week, but the week after that, I intend to do a Q&A on hormonal acne. So stay tuned for that. But tretinoin is very, very helpful, however, for acne on the forehead, acne on the face. It's also useful for acne on the chest and back. It can be used in those areas. People ask me that a fair amount. It can be used there for sure. Another thing that people then want to know is, well, how long is it okay to be on tretinoin? Is it something that I need to be on long term, forever? How long is safe to be on it? And I would say that tretinoin gives very good acne control so long as it is used and so long as it is used consistently, okay? And therefore, when it's stopped, you remove that level of control. And if the acne is still active, which is very different in every individual, if the acne is still active, then it's going to come back, okay? You've taken the control out, and the disease is still present within you, and so it's going to come back. Now, sometimes acne just burns out in older adulthood, and you can get off the tretinoin and the acne not be a problem whatsoever, okay? So it's individualized, and again, another reason to check back in with your dermatologist, particularly if you've been on it a while and you're just kind of like overusing it for whatever reason, and you haven't had any problems with acne in years and you want to think about stopping it. Check in with them, because that way, you can build in a few careful follow-up visits. If it does come time to stop it, and if it comes back and flares, well, you've got the appointment set up that you can get in and see them and get back on the right path to getting you better. Okay, so Yes, it can be stopped later on once the acne, if the acne within you burns out. Do know that if the acne within you is still active, that the stopping the tretinoin, the acne will just come back. But also what you should know about tretinoin is it is very safe to use for the long term and actually has other skin benefits, particularly with regards to reducing the number of sun-related pre-skin cancers or actinic keratoses. And like I said, with long-term continued use greater than 6 months, it can boost collagen production, improve the appearance of wrinkles and fine lines, and discoloration. So, it's kind of a good thing in a way to keep using and is safe, all right? The biggest reason in my mind to stop using tretinoin is if you're becoming excessively irritated by it, if you are getting so much irritation from tretinoin that, when you go outdoors, you're getting what's called post-inflammatory hyperpigmentation. So it's doing more, it's setting you up for more harm than good. By virtue of just the irritation that you're experiencing. That is a reason to stop it or to change the percent strength around a little bit. And then the other reason to stop it, at least temporarily, is during pregnancy and or breastfeeding, okay? It is not known whether or not it is safe during those times, so it is advised that they not be continued, okay? So if you're contemplating pregnancy, check in with your dermatologist for sure. Develop a plan for coming off of tretinoin so that you can do your family planning and discuss what other treatments would be safe in the meantime for you, such as azelaic acid, for example, is one that can be safely used in pregnancy, brand name Finacea. The other question that comes up a lot on here about tretinoin in terms of its use for acne is, well, if I stop it later on, is my acne going to come back worse? I'm scared to stop it. Is it going to come back worse? That's hard to predict, okay? Simply using tretinoin does not alter the pathophysiology of your acne to make it like build up animosity against you, if you will, and say, ooh, as soon as she stops this or he stops this, I'm going to come back even uglier and badder, okay? It doesn't work that way, all right? Tretinoin simply controls the acne very, very well. You stop it, the acne comes back, okay? And how it comes back depends on you, the individual, okay? So, the nature of everyone's acne is very, very different. Some people, unfortunately, are plagued by severe inflammatory subtypes of acne that maybe when they first presented were a little bit milder. Tretinoin controlled it. They came off of tretinoin. Then, later on in life, some other things changed. And now they have more drivers in their system, if you will, to push it towards kind of an inflammatory bad state. That has nothing to do with tretinoin per se, but tretinoin was on board. But when tretinoin was on board before, it was giving some control, and now you've taken that control away and everything's amok. But tretinoin does not make your acne down the road worse when it's stopped, in other words, okay? Very, very much, it's very, very fine. The other question that comes up on here a lot with regards to tretinoin is, well, I heard that the skin gets addicted to it and then it just becomes like lazy and used to it. Is that true? No, it's not. I mean, tretinoin provides long-term good control of the acne. However, you should be aware of the fact that, as I mentioned earlier, tretinoin alone is oftentimes not enough for certain subtypes of acne. So in your lifetime, your acne may change a little bit. So say, for example, you're a young teenage gal, okay? This is an example I can think of. And, you maybe had a little bit of acne as a teenager while you were going through puberty, for example, on the forehead, chin, and you were given a prescription for tretinoin and it was fine and dandy and things were good and you actually complied with it and you were trucking along, sticking with it. And, then later on in your later adolescent teen years and into early adulthood, college years, it started coming back with a vengeance, more in the jaw area. well, hey, you know, now it's tilting more probably towards a hormonal acne, in which tretinoin alone is just not enough, okay? So it's not that the tretinoin became useless. It's not that your skin got addicted to the tretinoin or used to the tretinoin or whatever. It's simply that the subtype of your acne is now different and tretinoin alone is no longer adequate, okay? So at the end of the day, what is very, very important for you to know is that, as I've said in all of my videos, acne is a disease, okay? It is not simply like a cosmetic issue. Like, it's simply not a cosmetic thing. Like, oh, I really wish that, you know, I had longer eyelashes. It's definitely more than a cosmetic issue. It's a medical condition. It has the potential to scar you. And importantly, it also has the potential to drastically and negatively impact your self-esteem, your well-being, your ability to function, your social interactions, okay? So take it very, very seriously, and you really need somebody on board, namely your dermatologist, who you feel comfortable with, that you can go to and follow up with consistently to make sure that you've got the best armamentarium in you for you as an individual and for you at your given stage in life, okay? Because it's going to be very different for everybody. All right, and depending on where you are in life and what else is going on, it's very individual. Because it is a disease, you know, you're somebody's patient, okay, and they treat you as an individual, and with respect and kindness, and they take into account your life, your goals, and you know, you as a person and what you want and your goals as a patient. So it's not really like a cookie cutter, you know, cookbook recipe in terms of use this cream for X number of days for acne. It's very, very individualized, and so definitely follow up with your dermatologist for sure. It is very safe to use for the long term, and I told this story in a vlog the other night. You know, my vlogs are a little bit more informal and kind of a peek into my life, but tretinoin, as I said at the beginning of this video and in that vlog, tretinoin started out as an acne cream, okay? And, you know, back in the 70s, all right? And, you know, when it came time for the teenager, because it's teenagers largely who initially get acne. And when the subgroups, you know, those groups of teenagers with acne were getting into adulthood and their acne was, you know, well controlled or whatever. And it first came time to start having the discussion, well, should we, you know, is it time to stop this cream? Let's, you know, kind of see what happens now that, you know, because it was new back then. A lot of people said, hey, I don't want to stop it. My skin looks so great. People started perceiving like that their skin was more lustrous, had a glow to it, had this more youthful appearance. And, you know, the docs started listening to that and subsequently led to more research, which now we know that tretinoin can actually boost collagen production and have cosmetic benefits on the skin. And it is also now FDA approved here in the US for wrinkles and fine lines. So, you know, that's probably desirable to many people, is the cosmetic benefit of it. And what we also learned from other studies is that tretinoin, when used in individuals who have a predilection for developing sun-related skin cancers, namely, you know, pre-skin cancers called actinic keratoses and sunspots, that consistent use of tretinoin long-term can actually decrease the number of those that you form. And that may seem like, okay, who cares? Well, you know, those things are kind of a pain on you, the individual, to have to manage. And, you know, it's not horrible, but you don't want to have to go through that, is what I'm saying. This cream can help lower those chances of it and have good benefits to the skin health, okay? So it's very safe and very good to use. The next set of questions that I get is oftentimes surrounding the different percentage strengths of tretinoin. You know, it comes in 0.5, 0.025. There are a variety of percentage strengths. It also comes in a cream versus a gel, okay? So I get questions about like which one is better, all right? I will say this, all right? They are all good. Oh, and also it comes in a micro-sized form called RETIN-A Micro, all right, is the brand name. I will say this, they are all very good. They are all efficacious. The higher percentage strengths, so for example, 0.1% is like the highest, right? The higher ones are more irritating, all right? People don't tolerate them very well, all right? So they're not a good selection in somebody who has a little bit more sensitive skin, who has never used a retinoid before. So they're oftentimes not the starting point, because nobody wants to start with something that's going to make them excessively irritated. However, they tend to be a little bit more expeditious in terms of onset of control, okay? So it's a balance between like, well, starting at the higher percentage strengths, how likely is it that this individual is going to be able to keep up with this long enough by virtue of the fact that it's so stinking irritating? How likely is it that they're going to be able to keep up with it enough that it can have its its quicker onset of action than a lower percentage strength, okay? A lower percentage strength, like say 0.5%, 0.05% or 0.25%, you may be able to, the irritation will be a lot less. You'll be able to stick with it and still have those effects. Don't think of it as like a competition or whatever, like I want to get up to the highest percent strength or whatever, because you're really not achieving much. Once you're on the tretinoin and it's controlling the acne, you've reached your goal, okay? And if you've reached it with the least amount of irritation in your skin, you're actually doing much better than if you reached it with excessive irritation in the skin. So think about it that way, okay? It's not like, it's not about like getting an A+ versus a B- or a C+. It's in terms of the percentage strengths. It's really about what you can tolerate to get you control of the acne without having excessive irritation. And that percentage strength is going to differ for different people. The other thing to know about the percentage strengths is that if you are a darker skin type, say for example you're Asian skin type or African American black skin type, Hispanic, non-white skin types, your acne is going to have more of a tendency to resolve with dark spots, which are problematic, and that is a part of the acne that needs addressing, okay? And the tretinoin can help with that a lot, okay? It can help with that a lot, but it can also harm it a lot by virtue of the fact that if you're having too much irritation from the tretinoin, it can kind of drive some of that discoloration, okay? So while the tretinoin goes to work in the cells to inhibit the biology that makes the dark spots, the tretinoin also is so stinking irritating that it kind of makes it a little bit more likely that irritation will occur. So in darker skin types, the lower percentage strengths are usually selected because it minimizes the risk of exacerbating those darker spots and discoloration that nobody wants. They're a real pest. Then in terms of the vehicles that tretinoin comes in, cream versus gel, which one is more efficacious? They're both efficacious. The gel tends to be a little bit more drying and irritating. The gel you may find, depending on what location on your face, back, chest, wherever the acne is that you're utilizing the tretinoin, you may find that the gel is better for you, okay? So have a discussion with your treating healthcare provider when the decision is made to start tretinoin about what percentage strength that both you and they think are good for you, and have a plan for the vehicle in mind, okay? And know that, hey, if things aren't going well, you should check back in with them, and maybe switching to a cream versus gel, switching to a different percentage strength may get you back on track for having the best results with tretinoin. Then with regards to the micro-sized one, the Retin-A micro or whatever, that one is also very good. It is very well tolerated. It has very low amounts of irritation, so people tend to like it, tend to be able to stick with it quite well. However, it is very expensive, okay? But, you know, then the other set of questions that I get asked about, I think by virtue of a lot of my different tips videos is, well, how can I incorporate some of my other acne treatments alongside tretinoin, okay? So tretinoin, as I said, is very, very irritating, and the irritancy of tretinoin increases if it is applied to the skin in the presence of water, okay? So you never want to put it on a wet face, first and foremost. As I said in my kind of tretinoin overview video. But you also want to talk to your healthcare provider about other acne creams, washes, treatments that you're currently using, whether they be ones that have been prescribed to you or ones that you are buying in the store and using. Talk about everything that you are using on your face currently with them, because some things have ingredients in them that are designed to exfoliate the face, and you may be tolerating them fine. Bring tretinoin on board, and the two together are kind of vicious and are going to really exacerbate the dryness and peeling that you're experiencing. And so definitely talk to the healthcare provider about what it is that you're using on your face currently, and if any of that should be stopped. And things that I'm thinking that come to mind to me are benzoyl peroxide as an active ingredient in like your acne washes, your acne leave-on gels, salicylic acid, for example, in your acne washes. Fine, great ingredient, and they can be used along with tretinoin after a while, a different, you know, alternating in different regimens. But if you go putting them on together at the same time, you can get a lot of irritation that can compromise the efficacy of the tretinoin and your ability to comply with it, okay? The other ones to bring up are your alpha hydroxy acids, lactic acid, mandelic acid, glycolic acid. You know, look very, very carefully at the ingredients in your, you know, cosmetic creams that you may be using. Make sure those things aren't present. Urea is another one that you want to bring to their attention. Just make sure that you aren't simultaneously applying things with kind of acid ingredients that are designed to exfoliate the skin lightly, because while they may be light and you may be loving them prior to tretinoin, in combination with tretinoin, it can be a deadly combination for you. So be very conscientious of that before starting the tretinoin, and it will make tretinoin a better path for you, okay? You want to have the best outcome with tretinoin. You don't want to compromise it, okay? So look at all of the ingredients of stuff that you're putting on your face. And my overriding tip would be minimize the number of things that you use, the number of products that you use, while at least while starting tretinoin, so that you can really give it the chance that it deserves to go to work on your acne and to get you good control. And by minimizing use, I mean basically anything that you buy in Sephora, just keep it in the cupboards for now. Don't go putting it on at the same time. A lot of things have fragrance, irritating botanic substances, you know, flowery extracts, which can be irritating to the skin, and when combined with tretinoin can really set the stage for a lot of problems and make complying with tretinoin difficult to impossible, and really jeopardize the control of your acne, which is a disease that has the risk of scarring as well as drastic, profound impacts on your self-esteem, okay? So, all right, guys, so I hope that answers your questions about tretinoin for acne. Next week, I will be talking about tretinoin for post-inflammatory hyperpigmentation, dark spots, and melasma. Tune into that if you suffer from these conditions and have questions about tretinoin for those. You know, this is a topic for folks I encourage to check out who have acne that heals with a dark spot. Some of the things that I'll address in that I think will be helpful to you. You guys and gals with darker skin types, I think that you'll enjoy the content in that, is my hope. So stay tuned for that, and in 2 weeks I will be coming back on board to the acne talks and picking back up with a highly requested topic of hormonal acne. So stay tuned for that. Hope you all are enjoying Vlogmas and having a festive time of the year, depending on where you are in the world. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next Q&A. Bye!